just filming the poster. Okay. Would you introduce yourself, please? Would you introduce yourself, please?
Oh, hey, I'm Johnny with Orange Grove and our mental health programs, our IOP and our PSR. Just got vaccinated.
Yay! And what advice would you have for DSPs?
It's really not a big deal. It's so fast. It doesn't hurt at all. It feels like someone poked me with a safety pin real quick and then it's done. Not a big deal.
Very good.
Great.
Thank you.
Yeah.
He's here today to get his vaccination, and I recommend all parents, especially children, to get their vaccine.
So you're here for both of you to get yours?
Yes, ma'am.
Well, very good. JD, how are you doing today?
Want to talk to everybody?
You don't have to talk to strangers, honey. I wouldn't either.
They don't.
Well, it's nice to see you both here, and I may ask you on your way out what your experience was like, okay?
Okay.
Okay, bye-bye. Hey, guys, how did it go?
It went perfect. Sat down, got right back up, never even flinched.
So everything was fine?
Yes, ma'am.
Very good. Any words of advice for other people?
Gonna do it. It's simple, quick pass in a hurry, and you're out. Come on.
Yourself, please.
My name is Terry Young
And where do you work, Terry?
at Lydian Court.
That's with Orange Grove?
Yes,
Are you here to get your vaccine?
yes.
And what would you say to other DSPs and workers?
I say get the shot. Don't you take medicine? You trust it.
Very good. Well, I appreciate you getting yours, and I'll probably chat with you on your way out.
Okay.
Yeah, that's totally fine. Yep. These Band-Aids never want to work with me.
I'm allergic to latex, so that's not a latex thing.
No, it's not. Alright. You can just relax your arm. Yep, that's it. You're done. Just put your Band-Aid on.
What'd you think, Miss Carolyn?
Good.
Okay, Miss Carolyn, I know you were apprehensive going to get your vaccine, and you just had it. How was it?
The vaccine was not painful.
Everything okay?
Everything went just fine, and they answered all of my questions concerning blood pressure medication.
Okay. And what advice would you give to other people who work in places like Orange Grove?
Just do your research like I did and look at the pros and cons, but do your research. And I think that will give you the assurance that you need to make the correct decision.
Very good. Well, thank you very much for getting your vaccine. We appreciate you. Hi, would you introduce yourself and tell me what you do here at Orange Grove?
Yeah, my name is Tom Carter, and I am a team leader for Pete and Larry and supported living.
Okay, great. Now, have you had your COVID-19 vaccine yet?
I've had one of the two.
And how was it?
It was fine, and my arm was a little sore for a couple of days, but other than that, everything was fine.
And what would you say to DSPs and other staff who haven't had theirs yet?
They need to go in and get it so that they don't get this COVID stuff.
Okay. Now, the individuals you support, 2 men, have they both had their vaccine yet?
They both have, and we're all three supposed to go have the second one on the 15th of February.
Okay, and did either of the men have a problem with the first one?
Not at all.
Okay, thank you. That's
Thank
all I
you.
need today.
Thank you.
I gotta hold it way up.
Right.
there. So will you introduce yourself?
I am Sean Ellis. I am the new Chief Presidential Officer for Orange Grove Center. I'm here for my day one vaccine.
Very good. And what would you say to DSPs and other workers who haven't had theirs yet?
Make sure that you get it. We want to keep everybody safe and healthy, and we need you.
Very good. Well, hey, Sean, you just had your vaccine. How'd it go?
It was probably the easiest shot I've ever gotten. It was actually painless.
Well, very good. And was this your first or your second?
This was my first dose.
Okay, well, good luck, and thank you for getting yours, and we appreciate you.
Thank you.
Hi, would you introduce yourself and this lovely young man?
Colin Eastland.
Is this your son?
This is my son.
Hello. You're doing good, buddy. And are you both here for your vaccine?
I think he's getting the vaccine.
He's getting it?
Yeah.
And what would you say to other parents? Do you think it's important, or?
If you love them, it's important.
Yes, it is. Yes, it is. Have you had yours, or will you when you're able to?
Mine Thursday.
Okay, very good. Well, thank you guys. I hope you have a good time, and I may chat with you on the way out, okay?
All right, thank you.
I just wanted to know how it went.
Went well. It went really well.
Any problems at all?
They ran out of serum, but it didn't take but a few minutes to get some more.
Well, very good. Well, thank you for coming and getting your vaccine. Looks like you did very well, and I'm proud of you both.
Thank you.
Hello, did you just get your vaccine?
Yes, I did.
Very good. How was it?
Very easy, just like a pinprick, and it was over.
Very good. And what would you say to people who haven't had theirs yet?
Oh, please go ahead, because we want the virus to go away. Go ahead and get it so we can all be safe.
Yes, very good. Well, thank you very much for getting yours. We appreciate you.
Okay.
Thank you. Hello, your name is Ann Patton, is that correct?
Yes.
And you can take your mask off because I'm sitting way over here. Hi, how are you?
I'm doing great today.
Good. Have you had your COVID-19 vaccine yet?
Yes, I had it Sunday.
How was it?
It was okay in the beginning.
Did you have any side effects?
I did. I had several.
What were they?
Didn't have a headache, but I was getting tired. And then I thought, well, I better tell people I'm not coming in Monday. So
You
I
just
did
took
that.
one day off because you were tired?
Yeah, but then Tuesday was my normal day off, so I took that too.
So how are you feeling now?
I'm feeling fantastic too.
And what would you say to people who haven't had their shot yet?
Just relax and let the nurse put your arm down if it needs to go down. And just sit there nice and quiet and they'll give it to you.
And do you think it's worth it to get a vaccine? Do you think people should have one?
Oh yeah, I do.
And why do you think we should all get vaccinated?
Well, I think, for me, I feel better. I can be around more of my relatives and my people here in Orange Grove.
Very good. Well, I am proud of you for getting your vaccine. I hope everybody gets theirs, and hopefully we'll get back to normal sometime.
Yes, I agree.
Okay. Thank you, Ann.
You're welcome.
Hello. Could you introduce yourself and tell me what you do here at Orange Grove?
Hi, my name is Quinte Malone, and I am a licensed practical nurse here at Orange Grove Healthcare Clinic.
Okay, and I will assume as a nurse that you have given lots of shots and vaccines in your life.
Yes.
About how many do you think?
Hundreds.
Do you find that there's any difference in giving a shot or a vaccine to somebody with or without a disability?
No.
Any reason why you think that any of the individuals we serve here, people with intellectual disabilities, should not have the COVID vaccine?
No, I don't feel like they shouldn't have it.
Would you think that they should have it then?
Yes.
Okay, and how about their staff, the direct care staff or their families? What do you think about that?
Think about them getting the vaccine?
Yes.
I feel if they feel like they want to get it, they should, and the ones who don't want to get it, shouldn't be looked at negative in a negative light for not getting it. It's just up to your
So
your
you
choice.
think it's just an individual choice?
Yes.
Would you encourage people who support individuals with intellectual and developmental disabilities to get vaccinated?
Like I said again, I don't want to feel like I'm pushing it on anyone. Again, I would feel like it'll be that person's choice.
Okay, good answer. Thank you.
You're welcome.
Introduce yourself and tell me what your role here is.
My name is Takia Taylor, and I am the certified medical assistant here.
And as a medical assistant, do you assist with vaccines?
I assist with vaccines and whatever the nurses need assistance with.
Okay. Do you think that there is any difference in giving a shot or a vaccine to someone who has a disability?
I think there is no difference at all.
Very good. And have you had your COVID vaccine yet?
I have not had my COVID vaccine, but it'll be fairly soon.
You plan to then soon?
Yes.
And do you have any recommendations for staff or individuals here at Orange Grove who haven't had theirs yet?
I would tell them, look, do some research. If you feel that you need it, go ahead and get it. And if you want to decline, that's their choice also.
Okay, thank you much. Would you introduce yourself and tell me your role here at Orange Grove?
My name is Candace Ghostin, and I am the nurse manager here in the clinic.
And have you had your vaccine for COVID yet?
I have not been vaccinated yet.
Do you plan to be?
I do plan to be.
And what would you say to other staff here who haven't yet been vaccinated?
I think that we all, in time, should be vaccinated to better take care of our patients and our families, keep everyone safe.
And what about the individuals that we serve here? Do you think that they're a high priority, or what would you say to them or their families about getting vaccinated?
They are high priority. I think that all individuals and family members should be vaccinated. Yes, ma'am.
Very good. And anything else you would like to say?
No, ma'am. I think we're on the right road, and after everyone gets these vaccinations and finds what's right for them, we can get back to our normal life again. I'm very excited about that.
Thank you.
Yes, ma'am. Have a great day.
Would you please introduce yourself and say what your role is here at Orange Grove?
My name is Dr. Robert Bohm, and I am the medical director at Orange Grove Clinic. That's my role.
And so how are things going with the pandemic? How is it affecting the clinic here and the people that you work with?
It's definitely changing our structure and the way we see our patients. We have a lot of patients who end up on quarantine and need to be seen at either at their home or at a specific time if they're sick. It certainly has limited our in-office visits.
In terms of the vaccine, what would you recommend both the staff and the individuals here at Orange Grove do?
Get the vaccine as soon as possible. I think it's very important to get the vaccine. We're seeing a recent study from Oxford that showed that the vaccine is limiting the spread of the virus in their population. It is working. It is the way to go.
Very good. Do you think there's any difference in giving a vaccine to someone with an intellectual or developmental disability as opposed to someone without a disability?
Absolutely zero difference.
But you would encourage families who have their individuals at home to get them vaccinated?
Most definitely.
And as far as family caregivers, I'm assuming they're also in a high need?
Family caregivers are also, especially depending on their role in community the rest of the way. If they're going out in the community, they're just as much at risk as anyone else.
Very good. Well, is there anything else that you would like to say in terms of how the pandemic is continuing to affect your patients, or?
Well, let's beat it. We're getting one step closer, and this vaccine is a step closer to our getting our lives back. So let's do this.
Well, thank you for everything you do here. We really appreciate having you.
Thank you, guys.